Today, welcome to our conference. This is actually our number 24th KPJ Healthcare Conference, where we have the theme of the healthcare transformations with reimagine and also redefining healthcare moving forward. As you know that this is actually not something ad hoc, right? We have actually been planning this for the past 24 years. And especially post-pandemic, we are very encouraged, to looking at today the crowd. I'm not sure whether have you all seen the crowd. We have not only our clinicians and our CEOs from our hospitals, right? More importantly, we have our industry, fellow other players actually from the similar facilities. Not only that, we also have speakers and panelists actually join us beyond Malaysia. So we have many of them actually came all around the world. Now, the significance for this, I think it is providing an intellectual platform, allowing doctors to really share, and more importantly, networking, right? How to looking at what is actually the evolving trends. And I think Dato have actually highlighted what will be the future needs, for us, and how can we really do it, act on it now instead of actually later. Because why? Patients are waiting, right? So I think the accessibilities and affordability is a big issue, right? We wanted to really address it, and this is actually the right platform where we have actually been provided to all our delegates to actually share their insight. And more importantly, what is the objective? The objective is really providing a network platform, because a lot of clinicians, at times where they are only focusing on their own specialties, they might not really realize what is actually the evolving healthcare landscape in the market. I think 12 months is just nice, for clinicians to come together, take a 1 or 2 days break, really network and understand how we can actually collaborate, work together. The even better, what we have actually heard from just now, Yang Berbahagia Datuk Sri Noor Azman, right, our Deputy TKSU, when he highlighted the important role where the private healthcare providers can be partnering, and more importantly, when Kementerian Kesihatan Malaysia, they were the largest, right, 149 hospitals. KPJ, we also the largest network hospitals in the market, with close to about 29 hospitals. So we do see a lot of potential collaborations, especially when KKM is looking at opportunity for decanting some of the services where we do have the capacity to really help to lessen the burdens of our ministry. So I think as we have, we really welcome the initiative, what the government is actually looking forward to, right? And truly, you're looking at how KPJ today, with the 29 hospitals, we are not only centered in certain state or city in the country. We have presence all the way from Perlis to Kuching, Sibu, Miri. So we have present really providing the accessibility to our patients. So I don't think there's any other player who will be in a similar position where we can really help the government of health. When just now, I think Datuk Sri mentioned about specifically 2 specialties, right, cardiology and cardiac surgeons. We do have many of our centers providing such services to our patients. So we do see this is a big opportunity, how the public-private can come together and really enhancing the value to our patients. And when Datuk Sri also mentioned about potentially having a bigger collaborations, right, to make it a big conference, I really welcome that. After having initial discussions with Datuk Sai, I think we can really host that by inviting KKM, clinician all comes together and really networking together with the private, not only KPJ, beyond KPJ, to really realize that public-private partnership. As you know that we are evolving into digital healthcare, and I think there's one big piece which we really want to enhance is the data-driven kind of organizations here. Hospitals, as you know that we have big data, but data will be useless if you do not change it into analytics, right? So we are in the midst of really going through the digital transformations, the front face in terms of the electronic medical records. How are we going to enhance the patient's experience, right, when it comes in over here? Accessibility into medical informations. Those are the areas that we want to do. Now, more importantly, towards the end, we want to make sure that the artificial intelligence, which is actually today is everywhere part of our healthcare, we want to blend in all this to really elevate the standard of care to our patients. Yeah, so this holomedicine is something very, very interesting, yeah. So as you all know, virtual realities, right? This blend in the imaging, so whatever we have actually done, the x-ray, the ultrasound and all, when we get the image, we are going to plug in into 3 dimensions. Now imagine if I were to do a pancreatic surgery. When I have the image, I put it in, I allow my clinicians and my patients collectively seeing what kind of a problem they are facing in 3 dimensions, anterior, posterior, laterals, then the patients will be having confidence to say that, doc, if this is actually where my problem, what will be your approach? The precisions in terms of designing, diagnosing, and then treatments. This is actually where we want to really enhance the quality of healthcare in the future. And Damansara 2, we have successfully blend in, and that is only the very beginning for many good things to happen in the future.
Audio Jungle.